Hey viewers and listeners, today we will discuss about myopathy. So it's a general term that refers to diseases that affect the muscles that connect to your bones, which are skeletal muscles. Myopathies may be passed into families or they may develop later in life. People living with myopathy may have difficulty performing activities of daily living like bathing, combing their hair, or standing up from a chair. Myopathy can be categorized by its cause. Basically, myopathies are separated into two categories: inherited and acquired. Inherited myopathies are those that you are born with, often from inheriting an abnormal gene mutation from a parent that caused the disease. Conditions that are inherited myopathies include congenital myopathies. Symptoms of congenital myopathies usually start at birth or in early childhood, but may not appear until the 10 years or even later in adulthood. The next one is mitochondrial myopathies, which is caused by a defect in the mitochondria, which are the energy producing part of cells. These conditions have muscle weakness but also a variety of other symptoms, as mitochondrial disorders typically affect other organ systems like your heart, brain, and gastrointestinal tract. The next one is metabolic myopathies. Defect in genes that code for enzymes that are needed for normal muscle function and movement cause metabolic myopathies. They often show as exercise intolerance, exertional muscle pains in your shoulders and thighs. The last one is muscular dystrophies, which is characterized by progressive degeneration of muscle tissue. Number 2 is acquired myopathies, which is developed later in life and can be due to other medical disorders, infections, exposure to certain medications, or electrolyte imbalance. Conditions that are acquired myopathies include autoimmune myopathy, which are disease in which your body attacks itself causing problems with muscle function. Next one is toxic myopathy, that happens when a toxin or medication interferes with muscle structure or functions. The third one is endocrine myopathies, which happen when hormones interfere with muscle function. That hormones are thyroid, parathyroid, or adrenal. The next one is infectious myopathies occur as the result of infections that affect muscle function, which are HIV, influenza, Lyme disease. High or low level of electrolytes can interfere with muscle function. That electrolytes are potassium and magnesium. Many myopathies share common symptoms. These common symptoms include muscle weakness, most commonly of your upper arms and shoulders and thighs, muscle cramps, stiffness and spasms, fatigue with exertion, lack of energy. Other symptoms vary depending on the type of myopathy. Muscle weakness can be either non-progressive or very slowly progressive. In some disorders, muscle weakness is intermittent with other normal periods of strength. Slow development of skills requiring the use of muscle in children, such as walking, hopping, climbing stairs, or grasping a spoon or pencil. Children who can't keep up with their peers during sports or games like tag. So the question is that how is myopathy diagnosed? Your healthcare provider will ask about your medical and family history, prescription, drug history, and your symptoms. Tests your healthcare provider may order include blood tests. Muscle enzymes such as creatine kinase or aldolase may be elevated in certain myopathies. Autoimmune disease testing, endocrine testing, electrolyte levels such as sodium, magnesium, and phosphorus. Electromyography, EMG, and nerve conduction studies, including testing the electrical conduction of your nerves and needle examination. Genetic tests, magnetic resonance imaging of your muscles. After determining your specific type of myopathy, your healthcare provider will develop a treatment plan specific to your symptoms. Most treatments include physical therapy, occupational therapy, and some form of exercise. Other treatments are more specific and based on the type of myopathy. In general, most acquired myopathies can be well controlled and treated to minimize weakness and symptoms. Please like and subscribe my channel and see you guys in a next video.